Hi there, I'm Dr. L, and I'm part of the diagnostic team here at Blur Pain Specialists. And today we'll be going through a rehab series with you. We'll be talking about things like posture, stretches, exercises, things that help manage your current pain right now, and things that help prevent pain from occurring in the future. So let's begin.
How can I relieve strain or pain from my SI joint?
So your SI joint is actually the connection between your pelvis bone and to the bottom of your spine.
So sacro-iliac joint pain is a threefold cause of pain that can come from your hip, your low back, as well as your sacrum, and it's much worse with weight bearing.
So when we talk about SI joint pain, sacro-iliac joint pain, we're referring to this region between your sacrum and your ilia, or your ilium for both of them. This little spot in between on both sides. It could be both or one-sided.
Find positions that don't further aggravate it. So if your low back hurts when you bend back, try to bend forward a little bit, or use your hips to tuck in which we call a pelvic tilt, throughout the day. It doesn't mean to stay in this position all day, but to rotate between the two. Other things that you can do, as I mentioned, is to strengthen the gluteal muscles, your legs in particular, as these will help transfer the stress from the joints to your muscles.
It's really important to make sure that we can stretch our adductors, we can strengthen our glutes, and that we can put ourselves and our pelvis into some pelvic flexion, and that way we can alleviate some pressure off that area.
So before proceeding with any of these exercises, it's always a good idea to get your condition assessed by a healthcare practitioner in your area to make sure it's actually SI joint related pain. All these exercises that we're going to go through today are safe and effective, but we want to make sure that they're specifically targeted for the SI joint if you are having SI joint pain.
One common exercise that we can do to activate the muscles in the back of the pelvis is called a glute bridge. So that activates your glute max muscle. So what you want to do is you want to squeeze your butt cheeks together and lift your pelvis up as high as you can. You want to hold this position for about 10 seconds, and then you want to slowly go downwards, okay? A common mistake that people will do here is that they will start tilting over and then start lifting due to a lack of muscular imbalance from side to side. So it's really important that you take your time, squeeze at the same time, and lift directly upwards as if you were thrusting all the way up through the ceiling. Once you're able to hold this position for about 10 seconds and you're comfortable in engaging that musculature, you can progress to holding for longer or doing more repetitions. So in order to do this correctly, what you want to do is you want to maintain a neutral spine, so a straight spine from the neck to the lower back. You don't want to necessarily arch any of your spine. You really want to engage that muscle to push you upwards. So when we push upwards, if I was to slide my hand under his spine, what I can feel is a nice flat sort of line. An incorrect technique is to extend and go into more of a bridge type of formation here. And now that way you're putting more stress on the joints of your lumbar spine rather than activating the muscles that are your glutes to be able to push your pelvis upwards. So the next exercise that we want to do is we want to make sure our ankles are together, okay? Our knees are together. We slowly bend our knees upwards. And now what we want to do is we want to rotate over to stretch and open that sacro-iliac joint without moving our low back. And now slowly go to the other side and try to go all the way down as far as you can. Ideally, your knees can touch the table or the ground, and then you would go to the other way. So what you want to do here is you want to do about 10 reps on each side for about 2 or 3 sets throughout the day. The next exercise that you want to do for the sacro-iliac joint pain is making sure that you get a lot of flexion into that area. So you want to make sure that the pelvis is tucking under itself to stretch those ligaments and the musculature in the back of it. So the one common exercise that you can do is called a knee to chest. You can start with one knee, bring it to your chest, hug it and pull. And then once you feel that stretch, it might be different for everybody. You might need to angle your hip in a different way or pull a little bit further towards yourself to be able to feel the stretch in that area. So you would do your right leg, then your left leg. Now at the same time, once you feel comfortable with that and you feel a stretch in both areas, you can bring both knees to your chests, give them a nice big hug, and then same thing, roll from side to side to stretch that area in the sacro-iliac joint.
Thank you for watching today's video. Please don't forget to like, comment, and subscribe. And for any questions about your healthcare, please contact our clinic directly.